Hello class, good afternoon. So let's continue our discussion. So let's proceed to food poisoning. So poisoning is the effect of swallowing, inhaling, and absorbing harmful substances on the body. When a person ingests poison or take that poison, the body cells and the tissues may be destroyed, which lead to severe discomfort or pain, and in some cases it causes death. So poisoning can cause death. So this is the most common poisoning that anyone can experience. That is food poisoning. It is caused by consuming contaminated foods and expired canned goods products. When a person experiences food poisoning, the following steps may be performed. The first one, keep the victim's mouth and nose open by tilting the head because they will experience hard um, breathing or hard breathing. Next is loosening clothing around the neck and waist for better breathing. Next is ventilate the area and watch the victim's breathing. And apply rescue breathing if necessary and seek for medical attention. So the first thing that you need to consider here is to observe the condition of the victim. Next is fainting o pagkahimatay. So fainting is a sudden loss of consciousness due to poor blood flow to the brain. So generally, weakness, cold, perspiration, paleness, and dizziness are symptoms before the victim gets unconscious. So sometimes they will experience it because of anemia, um, stress. So here are the first aid steps in fainting. Next is ventilate the area. So avoid okay, going or sticking to the person. Next is let the victim lie down or bend over and lower his or her head to bring back the normal flow of the blood. And if the victim does not recover within 5 minutes, then seek medical help. And the last step is apply rescue breathing if necessary while waiting for the medical help. Next is the musculoskeletal injuries. First is fracture. A break or crack in the bone. If it is advisable for the victim to undergo an X-ray procedure to diagnose the degree of fracture. So it can be closed fracture or open or compound fracture. So closed fracture, the bone breaks cleanly and it does not push throughout the skin surface. So this means that the bone is just within the skin. The fracture is within the skin of the legs or the arms. But if you can see the bone outside, then open fracture or compound fracture, if a broken end of the bone is damaged on the skin surface. Meaning to say, nakikita mo na yung bone na o yung buto na may fracture, lumalabas na siya sa skin, and that's open fracture. Stop the bleeding if the fracture is open. Do not apply pressure directly on the bone and never push the bone back through the skin. So let the medical personnel to do certain steps on how to carry the person or how to carry the victim. Do not move the victim because there is a chance that the spine has been injured. Do not move the injured part, but the fracture can be supported between the two hands. Be sure to keep the injured parts steady until expert medical help arrives. So wait for the medical expert. So the next is sprain and strain. So when you say sprain, it is an injury to the ligaments around the joint which may be stretched or torn. Ankle and knee sprains are usually the most common sprain injury. So sprains are often results from strong twisting of a joint, and it can affect wrists, knees, and ankles. So here are the signs of sprains and symptoms. First is pain in movement, swelling, and discoloration. The next one is strain. So strain is an injury which is caused by the twisting or pulling of a muscle or tendon beyond normal capacity. So okay, strain is more painful than, or sprain is more painful than strain, because in sprain you can there is pain in movement, swelling, and discoloration. But here in strain there are very minimal symptoms: severe pain, slight swelling, pain, and difficult in moving the affected part. So they are almost the same, but the only difference is in sprain, an injury to the ligaments around the joint, while in strain, it is twisting and pulling of a muscle or tendon beyond normal capacity. So ibig sabihin, you can have strain kung pinipilit mo yung sarili mong magbuhat ng napakabigat. So sprains and strains. Rest injured part. Apply ice packs or cold pads on the injured area. Compression. Wrap the injured parts with elastic compression bandage. And the next one is elevate the injured part as much as possible above the level of the heart to prevent or limit swelling. And for strains, rest and elevate the injured part. Apply cold packs for the first 10 to 15 minutes, but for back pain, apply moist heat. And next is seek medical help, especially for back pains. So next is dislocations. So a result of the separation of two bones at a joint. So fracture, if the bone is break or crack, but dislocations is the separation of two bones at a joint, leaving the bone out of normal position. So here are the common signs. First is bone deformity, pain, lost function of the bone. You can no longer use the part of your body with dislocation of the bone. So first aid is do not attempt to set the two bones ahead. Provide support of the affected part and avoid moving it, so you can use bandage. Apply cold packs on the injured part to prevent it from swelling, and seek immediate medical assistance. Next is muscle cramps. So muscle cramps can experience by anyone. So one of the most common type of muscle problems It occurs when a muscle suddenly contracts, resulting to a muscle spasms, pain, and lost movement. Muscle cramp is felt frequently in legs and hand muscles. So, what is the first aid for muscle cramps? First is gently massage the muscle with heel of the hand to stretch the contracted muscles. And next is there are times when muscle cramps occur while swimming. So if that happens, then stay calm and tread water while massaging the cramped muscles and yell for help.